had like real significant danger more often, it was hard to outrun the bear. But we still have the same stress response to adverse experiences that we don't like, that should be shut down, should be regulated. We learn how to regulate those stress responses. But when you have an environment where you have toxic stress, especially early on in life, the human brain doesn't learn that there's not always a bear, that you're not always in this extended flight or fight, fight experience that your body is experiencing. So when you think about children.
Back to the previous slide, because I know what a bear looks like.
Yeah.
No, the one with the
Oh, yeah.
that one.
Oh, sure, yeah. So I think that that's a good analogy of that, just this constant stress response. So I'm gonna, for the sake of time, keep going, and we'll make these available, and I can give this to you. So this is a picture of the first 2,000 days of life, which is essentially the first 5 years, and there is another rendering of a brain cell on the far left that's connected to other brain cells through synapses. And on the right is a picture of a human brain at age 2, a normal human brain on the left, and a human brain of a 2-year-old who had severe neglect. And you can actually see that the architecture, the size of the brain at the same stage of life is significantly smaller. So what does this mean for something like Ready for School? I mean, we're really focused on having kids have the preparation that they need to be ready for school in life. And so when you think about the brain and those basic functions that may be harder for children to generate, it gets in the way of developing foundational literacy skills, global competencies, character qualities that are all essential for our 21st century skill development. You heard in 1995 to 97 in California, the data for ACEs was first gathered, and then over a decade was looked at. And so California has been on the leading edge of this data. And the Center for Youth Wellness, which is in the San Francisco Bay Area, actually has a program that they have a 3-prong approach for children who have been identified as having high ACEs. An Adverse Childhood Experience Questionnaire is given, and that ACE questionnaire is not specific to which ACE. It doesn't matter, it's just the score that is reported. And then there are care coordination and multidisciplinary treatment teams, that are referred to right there when a child has an ACE score of 2 or greater. So what's happening in our area? Dr. May talked about her great clinical care here in Grand Haven. Ready for School, we have a multidisciplinary approach to those things that we know are getting in the way of children being ready for school. So on the outside, if you think of the child in the center in the green, on the outside are the multiple stakeholders in our community that come around the child in direct services, in supporting families and supporting parents. And healthcare providers on the upper left are a huge part of that. Reach Out and Read is a program. It's a well-child visit model that gives young children a foundation to link literacy and health, and healthcare providers in the Greater Holland area, and that would be available here as well. Links that pediatric care and helping buffer adverse childhood experiences through relationship building and modeling healthy relationships. And also accelerating access to positive experiences that children have through preschool, through quality childcare. I know the Grand Haven Schools Foundation has scholarships for preschool that are available, and we have those in the Greater Holland area as well. But the data is showing that those healthy experiences really do help buffer and mitigate adverse childhood experiences and through healthcare providers, these experiences and opportunities can be referred to. So this is our goal, is to have more and more children ready for school and to take adverse childhood experiences off the list of those things that can derail their brain development and their healthy thriving. So thank you. With that, I'll turn it over.
Ria Nygor is up next.
Yup.
Hello, my name is Ria. I'm originally from Japan, so I speak with accent, nothing you can do about it, right? I can't do it either. I work for Pine Rest in Holland, however, Grand Haven is so dear to my heart. I worked for OR, Autogun Addictions Recovery, in Grand Haven with Tim Bunning, and also my home is CMH. I see Lynn Doyle back there, and Anne, and we have a great community. I just let you know, I'm talking about trauma, that's clinical term we use when we collaborate with clients with this kind of difficult life experiences. Maybe you have some, I did. And for us to be together today, this is really, really hopeful. So thank you so much for coming. But first of all, I want to stretch out. I don't know about you, I'm just so stuck. Do you feel in your body that tightness? Come on! Oh, yeah, this is the best trauma care you can do. You don't ignore your body. I'm being serious. So we're going to talk a little bit about treatment. The message is this: trauma recovery is possible. If you don't remember anything, thank you, Jody. It's possible. It may take time. I tell you why. My definition, I don't go to the clinical thingy because this makes more sense to me in my soul. Trauma is defined by me is this: something that happens once or over time, and multiple different things may happen over time. That makes me cry. That is unsafe and often unpredictable or unexpected. Causes soul and heart injuries, sometimes physical injuries. Jolts inside of us so fundamentally flips our sense of safety and power and control, changes our sense of who we are to the world, and how the world is to us. That's my definition. And that's why trauma recovery takes time. But we can intervene, do something before, during, after. So all of us are touching on all that, right? Before, during, after. It takes you. That's the question you can ask to a person who may be struggling is this: not how are you doing? And they say what? How are you doing? Fine. Fine, of course. How are you holding up? How are you holding up? That's invitation. That's the best trauma care you can give. That invitation. And genuine care, the person can feel in you. That's no different when we have clinical setting or church setting or organizational setting. Because a lot of trauma survivors, especially childhood, chronic trauma survivors, they got antennae going out. Are you being real with me? But I don't feel safe even if you say you were being real. Right? So to be there, just extend your human presence in a small increment, coffee shop, Meijer, gas station, that's trauma care. Saying that, I mostly work with adults who are older, who went through a lot of life difficulties. But trauma recovery is still possible because our human brain is wonderfully made. There are new ways to connect the dots. Let people do wonderful things. They can change thinking, behavior patterns. All that can affect how they function. But trauma effects has these 4 kind of symptoms, things that we can notice, they can experience. They may remember some of the bad stuff from the past, even though they want to remember. It just comes intrusive. Nightmares or physical sensation, or they get emotionally triggered when they experience something similar emotionally. Or like they may have a hard time sleeping or really irritable and angry, these people who are very hard to deal with. Maybe they're not bad people, maybe bad things happen to them. Right? Avoidance, they don't want to talk about the past. Sometimes people don't know that was trauma. Oh, my mom used to sleep with me and used to touch me that. Nobody said that was bad until maybe they heard something in school like, interesting. Of course I'm not going to tell anyone. I didn't know that was bad. So, really working with adults, teens, kids, they may not know what they're going through is bad. That's their normal. That's why doctors are great. They ask some questions to educate them, right? Finding best therapist for that person's the best. If you don't like the therapist, fire them, or her or she or whoever that can be. You gotta like that person. Because trauma care is more experiential. You learn to have a relationship with the other person, to do life in the world. If they can practice that in the room, probably out there, 1 foot out at a time. So I would say look for good trauma-specific expert. They are in there, out there. If you don't like that person, it's okay. Ask for somebody else. You have a right to choose who you work with. It's okay. You don't even need to explain, by the way. Clients have right to choose. Sometimes it's clinically has to be discussed with therapists, but I know you know that, right? A lot of clients think they're crazy. I say, no, you're not. You may feel like, but bad things happen to you. It makes sense. It makes sense. Instead of don't get angry, you're so moody. No, it makes sense. It's all right. And then what can we do, right? First step is this, kids, adults, it doesn't matter, safety. Safety in the home, safety in relationships, food, sleep, regulate the basics. They are most important for everyone. Coping skills, most important. How can I reduce my anxiety in my body? This is very scary, right? Regulate the sleep. Adult, insomnia can be treated